stage. It's vacuous and empty, but it's got to be good cover. So, downturn economies in the last 4 or 5 years, Cynosure's had a couple of products that have done very, very well. Hundreds of doctors across the U.S. would say that they have made their money back, sustained their practice on the back of fraction.
Hi Tracy, how are you today?
I'm fine, Roberto. Thank you for asking.
Excellent. Now Tracy, today you're going to be a demo patient for Cynosure workshop. How are you feeling about that?
I'm feeling very excited. I'm really honored for the privilege. I've met Stephen before and I've heard about his work and I'm very excited.
Excellent. And how young of a woman are you?
Well, that's a trade secret, but I'm going to tell you today I'm 47.
Wow,
This past
wonderful.
August.
Well, after today's treatment, you are going to look a lovely 40 and a half years old. You're going to look fantastic. And do you have any concerns about the workshop at all?
No, I don't.
Excellent.
I'm in good hands.
You are in good hands. Well, thank you very much, Tracy, and then we'll catch up with you after the treatment, see how you're feeling.
Thank you.
Down. So I'll pie brush to give good coverage and avoid striking, especially on the chest or the décolleté and neck where striking is very common. Striking just means that some of the skin has turned a nice color and the other skin we avoided treating and didn't hit and it stayed brown and it gives you that tiger striking with the right pulse durations. And so that's our Max G, fairly nice spot size, very efficiently cooled, better than the Starlex 500, 300 that I had experience with before. I quite like this product. A bit dubious, but I must say, this is probably one of the best IPLs I've used for correctional vascular. It's so versatile and brown. Cool it, and then fire. Cool it, and then fire. So you don't have to be super, super fast. What you have to be is get a wow. And patients remember pain, don't they? And so she's going to see her friends. They're going to say, oh, Tracy, your skin's looking great. What are you doing? Well, I'm seeing Dr. Mulholland at SpaMedicaTV for the multiplexing, but normally it does work. Okay, nice little melting product here. And once we get up into the 60s, which is 2 degrees, I have no resistance here, and we're done with the melting process. Now we're going to go to tightening in a second. With our second zone, we're almost done this. She's doing fantastic. Okay, so now we're at 60, cut me off. No resistance. We don't have chunky fat. It's going to come up in nice liquefied aspirations. Now, last phase is we got to tighten her skin. So she doesn't have any loose skin after. What's our starting temperature there, Roberto?
You're at 33.
Okay, now we don't withdraw. We simply turn and we get that. Is this a feel? I can feel the temporal fascia. I pop through it and ooh, I drop right. There's a little pop. Did you hear that? Little pop. I drop into that sweet areolar plane between the deep layer of the temporal fascia and the superficial layer of the deep carpal fascia. It's almost like you're in the back of the hand in the metacarpal space. Lay down a little bit of product. You see that wheel? Massage it. If you're in the right plane, it evenly goes everywhere because it spreads. If you're in the temporal fascia or the muscle, it ain't going anywhere and you'll leave bumps.